So what are ketone salts? Well, ketone salts were developed at the University of South Florida in the lab of Dr. Dominic D'Agostino and first came on the market in 2016 through the Prove It Company. Now, the Prove It Company has done a lot of research to further develop and rebalance the salts that are in the ketone salts. These salts are sodium, potassium, calcium, and magnesium. And they are in a very specific proportion to help replace these minerals that may be lost when you're on a ketogenic diet or drinking a ketone product, such as a ketone salt or a ketone ester. So ketone salts come in a packet or in a tub that you can use a scoop. And basically what you do is you add them to cold water that is either still or sparkling. You can do other things such as adding it to make a gelatin or adding it to tea and broths. And now the company actually has broths and teas that contain ketone salts. They also have a product called MCT 143, which is a mixture of coconut and MCT oil, which they developed for me, which is discussed in another video here on this website. And they have keto cream, which is a combination of powdered coconut and MCT oil that is actually quite delicious. I use that in my coffee nearly every day. So back to ketone salts. There are a few things that you need to know if you are going to use ketone salts. One is you need to drink plenty of water so that you don't get dehydrated. They do contain a substantial amount of sodium. So people that have high blood pressure, that is a result of sensitivity to sodium, need to be very careful using a product like that and might not need to be able to use it at all, but it would need to be closely monitored by your doctor. Also, people who are using a potassium supplement need to be sure to, again, work with their doctor and choose one of the flavors or products that does not contain much potassium. Ketone salts and ketone esters cause the blood sugar to go down, sometimes very substantially, over as short as 30 to 60 minutes. So people who tend to be hypoglycemic need to be aware of this. People who are diabetic, taking any kind of diabetic medication or insulin, need to be very aware of this and need to very closely monitor the blood sugar before and probably hourly for 2 or 3 hours after taking ketone salts, at least the first few times until you know how your body's going to react to them. And then work with your doctor to adjust your medications if you need to do that. So those are just a few of the precautions about using ketone salts. If you are planning to use it for a child, an elderly person, an infant, anybody with a medical condition, it is very important to get your doctor involved so that you can be monitored, because there could be consequences if you're not aware of these various problems that I have discussed. And also, women who are pregnant or breastfeeding are naturally already in ketosis. And ketone salts have not been studied at all in pregnant women and women who are breastfeeding. So we don't know if there may be any negative impact on the fetus or not. So my advice is for women who are pregnant and breastfeeding to stay away from ketone salts and ketone esters. So those are really the biggest tips that I can give you on this. And if you are thinking about checking out ketone salts, I suggest that you look closely at the Prove It website. They're very strong on education, and you can get an idea of, is this something for you or your loved one? So that is the scoop on ketone salts.